Hello, I'm Naomi Page. I'm a consultant gynaecologist and work within the Hurley Group. Regular cervical screening is very important. It used to be called a cervical smear. It's important to get this done regularly, which means from the age of 25 to 64, you will be invited every 5 years for your screening test. It's important because it detects abnormal changes early in the cervix. And by detecting these early, it means that it's less likely to develop into anything more serious like a cancer. What it does detect are certain types of HPV, human papillomavirus. It is the high risk types of human papillomavirus that can cause abnormal changes in the cervix. When there are abnormal changes, if these are left unchecked, it can lead to cervical cancer. It is very normal to feel anxious or embarrassed or worried about coming for your cervical screening. There are many reasons why this may be. First is you may be worried that it is a painful test. It shouldn't be painful. Once it's strange or a little bit uncomfortable, it only lasts a few minutes. The other concern that some people may have is that the results will be abnormal. Please don't worry about this. In most cases, the test result is completely normal. If, however, there's any abnormality, you will get the chance to speak with your healthcare professional about what this result means. Another misconception is that an abnormal test means that you've got cancer. This is incorrect. What it does mean is that there are some changes in the cells covering the cervix, and invariably is not cancer. Some people who've had the human papillomavirus vaccine believe that they do not need to come for cervical screening. However, we would strongly urge that you do, as the HPV vaccine does not cover all types of high-risk HPV. Sometimes people can feel anxious, and it's okay to bring someone as a support with you to this exam. You may want to ask for extra time for your examination, especially if you're feeling anxious. There are other ways that you can feel a little bit more comfortable by asking the healthcare professional to use a small speculum or a little bit more lubricant, or indeed inserting the speculum yourself. Anyone with the cervix, including trans men or non-binary people, should come for their cervical screening. They are at exactly the same risk as anyone else with the cervix of having abnormal cells. Trans men, however, who've had a total hysterectomy do not need to come for cervical screening as they no longer have a cervix.